Welcome back everyone, Dr. Naveen here from UPSC MEDICO. So we're doing obstetrics and gynecology part of UPSC CMS discussion. So in the previous year papers, whatever I have analyzed, there are few important topics from applied physiology. Applied physiology, they're asking questions from physiology of menstruation, and they're also asking questions from physiology of fertilization. So from the menstruation part, from the menstrual physiology, the major area of focus is tests of ovulation. I think this is also relevant for many of other competitive exams too. If they want to ask one question from menstrual physiology, applied aspects, they'll ask you about tests of ovulation, for the reason being it is very important for investigating infertility, because ovulation is essential part of fertilization. If there is failure to ovulate, if you want to advise women to have sex or conceive at a proper time, you need to know the time of ovulation. So if you exactly know the time of ovulation, and if you can detect whether ovulation has occurred or not, based on that you can definitely advise treatment in cases of infertility, right? So what are all the tests do we have in case of test for ovulation? One most important commonly done test, but nowadays obsolete, is basal body temperature method. There was one PYQ on this topic. Similarly, in many of other competitive exams, I had seen questions coming from cervical mucus test. So in the cervical mucus test, you have Fern test, and one more thing, important thing, is thread test. Okay, we'll also look into these tests. And third area where questions are coming is endometrial biopsy or sampling. Let's say endometrial biopsy or sampling, endometrial sampling. And fourth most important, and actually this is the test of choice which is usually done, non-invasive, is ultrasonic visualization or ultrasound visualization of the Graafian follicle. This is actually serial ultrasound. Okay, I'll let you know what is the time period when to do serial ultrasound, but most reliable and most sensitive. Most reliable and most sensitive. And number 5, what we have is, number 5 is hormonal studies. So I had seen questions coming from these aspects. Like there was one question on basal body temperature method, there was also question on endometrial biopsy, and there was also question on hormonal studies. Maybe in the future exams of UPSC CMS, you might expect questions coming from cervical mucus study and ultrasound, which we'll try to cover in this part of discussion. Now we'll come back to first thing, that is basal body temperature method. Let's do it with the help of a MCQ. Now here, as you can see, which one of the following is true about basal body temperature? Which one of the following is true about basal body temperature? So when you want to know about the basal body temperature, the first important point that you should understand is there is actually a biphasic pattern of temperature change in women of reproductive age group. Okay, in women of reproductive age group, there is a bitemporal thing. So how to understand this? Let me draw a line. Okay, let me draw a line, and let me draw a day of ovulation, that is day 14, right? Day 14. And this side, the first phase is because of the follicle, then we call it as a follicular phase. And the next phase is because of the corpus luteum, we call it as a luteal phase. Now when you track basal body temperature, the average temperature probably around 36.6 degrees centigrade, right? So when you track it, what happens? There is a dip of basal body temperature. There is a dip of basal body temperature at the time of ovulation. Okay, actually at time of ovulation there is fall in BBT. This is in the range of 0.5 degrees centigrade, or they say 1 degree Fahrenheit, whatever it is. Okay, so there is a fall in basal body temperature at the time of ovulation, and after the fall then starts the rise in basal body temperature. So the rise in basal body temperature actually occurs in the luteal phase. So this rise in luteal phase is because of two hormones. So there is one more MCQ here. Primarily because of norepinephrine, and secondarily because of the thermogenic action of progesterone. We all know the first phase of menstruation is mainly because of estrogen, and the second phase is mainly because of progesterone, and progesterone is thermogenic, and it has secondary effects on the body basal body temperature. But primarily the elevation in body temperature post ovulation is because of, if you want to choose one best option, it is norepinephrine. The rise in temperature is because of thermogenic potential of norepinephrine. The secondary rise is because of the progesterone, that too in the luteal phase after 1 to 2 days of ovulation. So the rise is after 1. So what do you advise women? You advise women to check oral temperature with the help of a thermometer which is highly sensitive. It should be able to measure even 1/10 of a degree. Okay, then only you can identify this minute change of 0.5 degrees centigrade, right? So when they check oral temperature, it should be done first in the morning, and she should be advised to take nothing, hot liquids or cold liquids into the mouth. Immediately after getting out of the bed, ask her to take the first thing in the morning is check the basal body temperature and track it on the chart, any of the chart. But problem with this basal body temperature is it is cumbersome. It's time taking process. It's a daily routine, right? Even if you miss one day, you might not appreciate it. So that's the reason it is obsolete now. And one more problem with this is you cannot detect time of ovulation with this. It's kind of retrospective diagnosis. It can only tell you whether ovulation has occurred or not. It will not tell you when is the ovulation going to occur. So the changes happen only after ovulation. So if you know ovulation after occurring, you cannot plan any infertility treatment or IVF treatment. So basal body temperature is not suitable for IVF methods, in vitro fertilization. It is only a retrospective way of diagnosis. Only a retrospective way of diagnosis. Now let's try to look at the question and understand this concept in more detail. So we are looking at basal body temperature test of ovulation. Which one of the following is true about basal body temperature? It's a biphasic pattern. Yes. So this is biphasic pattern because there is a fall in temperature, then occurs rise in temperature. And you know what happens if you keep on tracking it after the rise in temperature, just 1-2 days before menstruation, again the basal body temperature comes back to normal. That's why it is a 2 phases. One rise, other is fall. This is only in non-pregnant women. You know what happens if the woman becomes pregnant? Instead of temperature coming down, it stays in the same. So it behaves like a monophasic pattern. Basal body temperature returns to normal. It attains biphasic pattern only if the woman is non-pregnant. If the woman becomes pregnant, then it's a monophasic pattern. So this is one thing you want to know. So it's a biphasic pattern. I think it's correct answer. Increase in level of progesterone and norepinephrine. Yes, primarily because of norepinephrine rise and secondarily because of the progesterone rise. And temperature falls by 0.5 degrees centigrade after ovulation. I think this is a confusing statement because it should be at time of ovulation or at the time of more predominantly LH peak. LH peak or ovulation, temperature falls. But after ovulation, it is rises. So it should not be fall. It is rises by 0.5 degrees centigrade after ovulation. It's not at the time, it is after ovulation. And it can predict ovulation precisely. No, you cannot precisely predict the time of ovulation. After ovulation has occurred, then you can notice the change in body temperature, right? So it is a retrospective diagnosis. It is not a prospective diagnosis, and it is not useful for IVF methods. What is more useful is ultrasound visualization of the follicles. So the correct answer here is 1 and 2. So which one of the following is true? It is biphasic pattern, and it is because of increase in level of progesterone and norepinephrine. So this concludes our tests of ovulation basal body temperature part. Now, as we were discussing the different modalities, we are done with basal body temperature method. Now let's focus on endometrial biopsy or sampling with the help of 2 questions. Let me read the question for you. Now, if you want to do endometrial sampling, why do you do endometrial sampling? Because whenever menstrual cycle occurs in 2 phases. So you have 2 phases of menstrual cycle. Menstrual cycle, yes, it occurs in ovary. The major changes in ovary is you have follicular phase, which is first 14 days. And you also have luteal phase, that is formation of the corpus luteum, which occurs in the next 14 to 28 days. At the same time, what happens in the ovary, in the uterus? In the uterus, you will notice proliferative changes. Uterus proliferates from day 5 to day 14 after menstruation, and 14 to 28 days you notice secretory changes. So if you do uterine biopsy or uterine endometrial biopsy, we don't do curetage right now, guys. We have special pipellae sampler which helps in sampling or aspiration of the endometrium. Okay, so instead of endometrial biopsy, the new terminology what they use interchangeably is, we don't go for endometrial biopsy, we go for endometrial sampling with the help of, I'll show you how pipellae curate looks. So this is pipellae curate, okay, or aspirator or pipette, which would be more appropriate. Okay, so pipette I'll show you, but what is more important is you can identify secretory changes in the endometrium which are because of progesterone secreted by corpus luteum, which only forms after ovulation. So if you notice secretory changes by doing endometrial sampling, it indicates that ovulation has occurred, right? I think that's the best way to conclude. Ovulation has occurred because you have noted secretory changes. Now let me write what are the secretory changes. So the secretory changes you note on endometrial sampling is, number one, there is increase in stromal edema. This is microscopic appearance. You notice increase in stromal edema. Second thing is there is a global increase in endometrial thickness. So what are all the secretory changes you see? You see increase in stromal edema, you see global increase in endometrial thickening, and the third thing is there is rapid lengthening of spiral arteries. Spiral arteries, they rapidly lengthen, and the coiling of the spiral arteries increases. So when you notice spiral arteries, they coil and they lengthen, and blood supply decreases at the tips, and these tips undergo necrosis, and if pregnancy fails to occur, if the woman fails to conceive, the superficial layer, the topmost layer, it sheds, triggering menstruation. So this is the usual change. So these changes, that is increase in stromal edema, global increase in endometrial thickening, and rapid lengthening of the spiral arteries, and also increase in coiling of the spiral artery, indicates secretory changes have occurred. So that's the endometrial sampling helps in diagnosis of ovulation. Now when to do this endometrial sampling, that is the question. So as I was telling you, look at this slide. So this is pipellae curate, which is disposable endometrial biopsy curate. So endometrial biopsy or sampling are interchangeably used in the textbook. Biopsy is little more invasive. Sampling, we only do aspiration. So endometrial sampling is obsolete nowadays because it is invasive. We don't do it. It's only for theoretic purpose. Now yes, definitely endometrial sampling is more useful for other indications like dysfunctional uterine bleeding, abnormal bleeding, that is AUB because of hormonal replacement, or perimenopausal or menopausal bleeding, which is more important rather than for diagnosing of ovulation. When you do aspiration, let's say this is the uterus, somehow there is pregnancy. Okay, pregnancy. If you aspirate it, what happens? You're aspirating it to study the endometrium, but the problem is at the time of aspiration or sampling, if the woman is pregnant, it might dislodge or disturb the pregnancy. So when I say what is the ideal time to go for endometrial biopsy? The ideal time for a woman to go for endometrial biopsy is actually during menstruation. So if given a choice, this is the best way to go. But if you know exactly, if the cycles are regular, if the cycles are irregular also, you have to do it during menstruation just to avoid dislodging the pregnancy. But if you know exactly the cycles are regular, you can do this endometrial sampling between 21st to 23rd day. There is a controversy here because Shaw textbook of gynecology mentions it as at menstruation, at the time of menstruation, or 1 to 2 days before menstruation, whereas Datta definitely mentions it during menstruation. But if the cycles are regular, you can do it between 21st to 23rd day, 21st to 23rd day of the cycle. So based on this simple fact, they asked two questions. Which, look at here this slide, which of the following day of menstrual cycle is best for endometrial sampling to diagnose ovulation? The answer is 21st to 20th day. The same question got repeated recently in 2023 and also in 2021. Endometrial sampling for diagnosis of ovulation is done on which day of menstrual cycle? It is 21st to 23rd day. What is the controversy here? But it can be done only if the cycles are regular. Okay, and after doing sampling, you have to give a precaution. What is the precaution? Post endometrial sampling, you should advise women to go for barrier contraception. Okay, barrier contraception during the cycle. Okay, it should be precaution before doing the sampling itself. For example, a woman of 32-year-old suffering with infertility, you want to do endometrial biopsy for testing ovulation. So you will be planning it on 21st to 23rd day of cycle. So before performing the sampling itself, starting of the cycle itself, you should advise women to start having barrier contraception. So this precaution is very important to prevent accidental conception. If the cycles are irregular, it's better that you do it within 24 hours of the period. Okay, within 24 hours of the period. And remember this, if you're also giving NEET PG or INSIT where image based questions are asked, this is the Pipille accurate, which is most commonly used for endometrial sampling. Endometrial sampling is not done as a routine for tests of ovulation because it is invasive, but it is actually done for diagnosis of AUB. It can be dysfunctional, it can be hormonal, or it can be menopausal or premenopausal bleeding. So these are the few things that you need to understand. Now, we're discussing tests of ovulation. I think we're done with both BBT and endometrial biopsy or sampling. Now let's look at the hormonal studies. Hormonal study, one area I could see a lot of questions coming up is this one. What is this? The simple term, you might have seen so many questions, LH surge. So what is this LH surge? Follicular phase, the follicle, it secretes FSH, and FSH leads to increase in estrogen. So whenever there is an increase in estrogen, then there is triggering of release of LH. So this estrogen predisposes to LH surge. So whenever there is rise in estrogen, this leads to increase in LH levels, that is LH surge, and LH peaks, and after peak levels of LH are reached, within 12 hours ovulation occurs. Now there are multiple questions in this, Ovulation occurs after 10 to 12 hours of LH peak. At the same time of LH peak, one more hormone which peaks is FSH. Because the levels are not high, we don't measure them. Okay, at the same time of LH peak, even FSH also peaks. But what is more important from exam point of view is 10 to 12 hours of LH peak. Okay, ovulation occurs. And if you want to ask one more question, that is 32 to 36 hours of LH surge. So LH surge, after occurring LH surge, it takes around 32 to 36 hours for ovulation to occur. Okay, and estrogen peak, the time period between estrogen peak and LH peak is 14 to 24 hours, which is rarely asked, but again you need to remember. So I can say estrogen peak occurs 12 hours before LH peak. Estrogen peak occurs 12 hours before LH peak. Right? Now let's try to solve a question on LH surge and we'll come back to the hormonal levels again. So which one of the following is true regarding normal menstrual physiology? Threshold of LH surge generally persists for 48 hours. No, see this LH surge, what you see, it does not persist for 48 hours. It persists in the range of 24 to 36 hours, not 48 hours. The whole peak, the surge, see the surge and fall, the threshold persists for only 24 to 36 hours. So option 1 is wrong. Estradiol levels peak at 48 hours prior to ovulation. It's not 48 hours, it's more than that. Because as you can measure here in this image, let me show the same values again. It's mentioned in the books that estradiol levels peak. What is this? Here is the peak and here is the ovulation. You have 32 to 36 hours here plus 14 to 24 hours in between. So it is more than 48 hours. So this statement is wrong. Next is ovulation occurs after 12 hours of LH peak. This is more ideal. See, LH peak 10 to 12 hours, you're seeing ovulation. So the correct option is option 3. So this question was asked in 2009. So we're discussing LH surge. The LH surge is because of estrogen. LH surge is very important because luteinizing hormone helps in maintaining of corpus luteum, and this corpus luteum secretes progesterone so that the uterus becomes secretory. Okay, there is endometrial proliferation of the uterus. So also see the hormonal levels here, the same thing. You have FSH peak here. At the same time, you have LH peak and LH surge, and this is the time of ovulation. And before LH surge itself, you have a estrogen peak. And when does progesterone peak occurs? Progesterone peak occurs at the 22nd day. That's why we are doing 21 to 23 days endometrial biopsy to see the secretory changes, because progesterone levels are high during that phase. Why it is important to detect LH surge? Because nowadays we have LH kits. If you know the LH surge, it indicates that ovulation is going to occur just after the LH peak, like maybe within 1 day. If you advise women to undergo sex and for conception, more chances of becoming pregnant. So it is useful in treating infertility cases, and this is the LH kit what we have. Okay, we check for urinary levels of LH. Okay, with the help of this, whenever there is a thick line, it indicates that LH peak has occurred. You should advise women to undergo sex within 24 hours for increased chances of conception, right? So finally, we're done with the 3 important things. What are that? We have done with basal body temperature method. We are done with endometrial biopsy, and we're also done with the next thing, that is the hormonal studies, LH surge. Okay, when does it occur, and what is LH peak, and what is estrogen peak. We're left with serial ultrasound and cervical mucus test. When I want to tell you about daily ultrasound visualization of ovaries is done during which time period? It is done during 10 to 16 days, because they have asked a question on time period of endometrial sampling. Maybe in the future they might ask a question on when is the serial ultrasound visualization of ovaries is done to check for Graafian follicles. It is 10 to 16 days. It is non-invasive, accurate and safe. And you know, follicle grows at a rate of 1 to 2 mm daily, and it finally reaches the Graafian follicle at the 20 mm is the maximum size, and after that it ruptures at the mid cycle. So when you serially follow it, after 14 days there is sudden disappearance of the follicle, and there is presence of free fluid in the pouch of Douglas. So then you see growth of corpus luteum. So these are all the phases or stages of menstruation which you can visualize with the help of ultrasound. Though it is costly, it is accurate, safe and non-invasive. Very important. And finally, we'll conclude your discussion by discussing a little bit more on cervical mucus test, which can be a future probable question, right? So we're discussing cervical mucus test. I could see a lot of questions coming in the recent NEET PG and INSET on this. There are 2 tests here. One is Fern test and other is thread test. So there is always confusion for students. See, thread test is also known as spin barkate, sorry if I pronounce it wrong. Okay, phenomenon, spin barkate phenomenon. Please, important. Spin barkate phenomenon is not Fern test. Spin barkate phenomenon is thread test. And one more question we always tend to confuse is there is a mechanism called tack or tacking. It also comes in thread test. Then what is Fern test? We'll come back to the Fern test first. So Fern test, it is cyclical changes occurring in cervical mucus under the influence of estrogen. So let's take a drop of cervical mucus and spread it on the glass slide, and this is during pre-ovulatory phase, or we call it as estrogenic phase. Pre-ovulatory is under the influence of estrogen, post-ovulatory is under the effect of progesterone. When you see it, it shows a palm leaf. It's palm leaf or fern type of reaction. That is, it looks like a palm leaf or fern type of reaction. Okay, so this is how it looks, and it is because of NaCl. Very important. So the fern type of reaction is because of NaCl. Don't get confused. It is in the pre-ovulatory phase under the influence of erection. If at all under the influence of progesterone, what happens? This fern type disappears. So disappearance of the fern pattern indicates ovulation, not appearance of fern pattern. Many of the students, they get confused. It is disappearance of fern pattern under the influence of progesterone indicates occurrence of ovulation. So cervical mucus test, fern test is done. So the next is Spin-Barke phenomenon or tacking. See, when you collect ovulation mucus, it has property called elasticity. So I could say cervical mucus is elastic. Okay, when you try to stretch it, it can withstand a stretch of 10 centimeters. If you take two glass slides, if you drop a mucus surmuxa and if you stretch it, because of the elasticity, there is a thread like activity. It becomes like a thread. Up to 10 centimeters you can stretch the mucus. Okay, and this elasticity is because of estrogen. It is elastic. But what happens after ovulation under the influence of progesterone? Elasticity is lost. During the secretory phase, it becomes, instead of elastic, the counter other word is, it becomes tenacious or it becomes viscous. It becomes tenacious or the viscosity increases, so it loses the property of elasticity, otherwise known as Spin-Barke, and when you try to stretch it, it fractures. And this fracturing property is known as tack. So what is tacking or tack? Tack indicates, I could say, Spin-Barke indicates ovulation. No, Spin-Barke or thread-like activity because of the elasticity does not indicate ovulation. It is during estrogenic phase, that is provulator phase. If ovulation occurs under the effect of progesterone, elasticity is decreased, viscosity is increased, that becomes it is more tenacious, it cracks. That cracking property is known as tack, and this tack indicates that ovulation has occurred. So these are the few things I want to tell you about the cervical mucus test. And finally, there was a in Datta textbook of OBJ, they have given a beautiful table. This is very important because you might expect 1 mark from this for sure. Okay, these are all the identification factors, that is ovulation factors. We have BBT, endometrial biopsy, cervical mucus, and also vaginal cytology, which we failed to discuss, and hormonal studies, serial ultrasound, and even you can do laparoscopic examination for secretory phase or to check for recent corpus luteum. Okay. Now we're done with the serial transvaginal sonography, is done during days 12 to 16. Actually it should be 16, but they have given it 14. We do serial follicular measurements. We check for reaching of 20 mm. Okay. And yes, hormonal studies, mainly serum progesterone, serum LH and urinary LH. Serum progesterone levels are estimated on day 8 and day 21. Day 8 levels are low, but day 21 levels are highest, that is 1 nanogram to 6 nanogram ml. Similarly, serum LH, we know mid-cycle daily we measure to check for LH surge, and LH peak occurs about 10 to 12 hours. Actually, it should be LH peak. LH surge means it is 32 to 36 hours, right? So you know this. Now urinary LH also the same. Now we're done with BBT. You know, it is measured throughout the cycle and there is biphasic pattern. Endometrial biopsy also, I told you, it should be done in the days 21 to 23, and we check for secretory endometrium. And cervical mucus, I told you there are different properties, that is threadability and fern pattern. And when to check for that, pre-ovulatory we do it for 12 to 14 days, and post-ovulatory we do it at the age of 2 samples of cervical mucus should be taken, 12 to 14 and 21 to 23. When you look for the property, the nature, it's clear and watery. The cervical mucus is clear and watery on day 12 and 14. It is very thick and viscid in day 21 and 23. And also threadability and fern pattern are present. Threadability or fern pattern are present before ovulation. Threadability is lost and fern pattern is lost after ovulation under the influence of progesterone. And final important thing which we failed to discuss or which we did not cover is the vaginal cytology. Okay, vaginal cytology. The vaginal cell examination can be done in the pre-ovulatory and post-ovulatory period also. When you look for the vaginal cells, they are discrete pycnotic nuclei. Background is clear. In case of pre-ovulatory. In post-ovulatory, vaginal cells have folded edges, they look in clumps, and the background looks dirty. So this is about the vaginal cytology, which helps in detecting the ovulation, and all these are tests of ovulation, very important for UPSC CMS exam, and they ask answer writing even during your MBBS theory exams and also in medical science optional UPSC civil service exam. This test of ovulation is a frequent repeat question, even in NEET PG and INSUTs also. This is very important. So with the help of few questions, I think we were able to cover all the concepts related to tests of ovulation.